What if I told you that the end of the COVID-19 pandemic may mean regulation changes for many of the things we've grown accustomed to, including healthcare? That's the issue facing Medicaid right now, with millions of individuals may having to re-enroll. So what caused this and what can you do about it, especially if you're among the affected? Katie Meyer, the government editor and reporter for Spotlight PA, joins us to talk about those issues and more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. As the country and the state and our communities emerge from the COVID-19 pandemic, there are certain rules and regulations that are sunsetting and others that are coming back into play. And this affects a lot of different things that affect all of us, including healthcare. And one of those issues involves Medicaid and may involve changes for millions of people on Medicaid. We're joined by Katie Meyer. She is the government editor and reporter for Spotlight PA. She has covered this issue extensively, and she joins us tonight. Katie, welcome to Face the Issues.
Thanks for having me.
Thank you so much for being here. Katie, you are with Spotlight PA. You wrote a piece recently called PA Medicaid Re-Enrollment, What You Need to Know to Keep Your Health Insurance or Find Other Options. Let's just start with the 30,000-foot question. In a quick summary, what is happening with Medicaid?
Sure. So the big change is that people now have to re-enroll annually. So if you're a person who uses Medicaid, you know somebody on Medicaid, you might already be familiar with this. But traditionally, under the program, you had to do an annual re-enrollment. So the federal government and the state would reassess whether you qualify for Medicaid every year. You have to, submit proof of your income. You have to submit all sorts of data about yourself, and then you either stay in the program or you get kicked out if you no longer qualify. And during the pandemic, beginning in 2020, those annual re-enrollments stopped. Basically, you would stay in the program if you were in it in 2020. And that was a tactic that the federal government used to make sure that people didn't lose their health insurance during the pandemic. That is ending. So it sunset at the end of last year, and beginning this month, it was the beginning of this month where it started, people who are on Medicaid have to re-enroll again. And the implications of that are, there's a couple different ways this affects people who receive the benefit and also affects the state and the workers who do these re-enrollments. One of the big ones is we have a lot more people now on Medicaid because re-enrollment was paused for 3 years. So, the number has just increased, and that'll mean that more people lose the benefit. And so, some ways, the state has been doing sort of, we call them like dummy re-enrollments. They've been sending out the paperwork anyway, but now for the first time in 3 years, you can actually lose your coverage if you do not fill out your paperwork correctly, if you don't if you don't qualify anymore, if your income's gotten too high, and that's what people should really be aware of.
So this is a return to the way the policy worked pre-pandemic. This is not a new set of regulations. This is how they used to do it. They paused it during the pandemic, and now they're going back to it.
Yep, exactly.
One of the things you brought up was that there are a lot more people on Medicaid now than there were then, in part because nobody was being kicked off. But we're also facing a staff shortage. Could you address that briefly? Why is that the case, and what do we expect the impact of that to be?
Yeah. So again, I mentioned there's like a couple ways that this re-enrollment is affecting various parts of the Medicaid system in Pennsylvania. One of them is just, it's unrelated to re-enrollment really, but there is a staffing shortage. This has affected a number of sectors in the state, outside of the state government. But yeah, there is across county assistance offices and the call centers that process Medicaid re-enrollments, we've been seeing some pretty significant staffing shortages. And, Department of Human Services, which administers these programs, oversees these offices, they've acknowledged that. I think they've tried to downplay it a little bit. They're they're working on getting those staffing levels back up, but there are shortages. And the way that this affects re-enrollment, though, is that when you have this kind of boatload of people now needing to re-enroll in the program for the first time, you have more people than the system usually handles re-enrolling, and you have staffing shortages, that's kind of it's a mix that comes together to create potential overloads in the system. So one of the things that I'm looking at, and one of the things a lot of medical access advocates are looking at is the system going to get overloaded? Will mistakes be made? Are people going to wrongly lose their insurance because the system is backed up or because caseworkers make mistakes? And again, this is, no issue that we're pointing to for an individual caseworker or anything like that. But, the system, people can get stressed. Workloads get really large.
Mm-hmm. Reminiscent a little bit of early COVID era, the Department of Labor ended up being short-staffed, having to process so many waiver applications from small businesses. There's just a backlog because there's so many applicants and so few people working, so few staff members. And so I'm sure there's some nervousness about coming into this process, especially as it deals with healthcare. Katie, let me ask you this. One of the questions that we're inevitably going to get is, how does somebody know if they're still eligible? Have the standards and the thresholds changed? And how will an individual who is watching this know whether they're still eligible for re-enrollment?
Yeah, so and these are like the real questions that I'm glad we're talking about. So yeah, if you're a person on Medicaid, you might be familiar, the income thresholds that qualify you for the program can be kind of complicated. It changes if you have kids, it changes if you have a disability. There's a lot of factors that go into it. The best way you can make sure you are, checking whether you're eligible is there's a couple things. The Department of Human Services has this service called Compass, which is a way for you to get your information updated online and also just check if everything's in there, check if you're missing some paperwork that you might need. So go to Compass. You can do it all online. If you prefer, you can also call the statewide customer service center. They can help you. You can go to your county assistance office. And I can hopefully, you can search it on Spotlight PA. It's on the website. But in the article that I wrote, there's like a long list of resources you can use. But I would say make sure that all of your information is up to date, because DHS will be reaching out to you several times using the mail. And you can also get text updates from the department as well. And these are just automated. You'll get them if your information is correct. So make sure your information is correct. That's the biggest one.
The other question, you talked about this in your article too, is when do people re-enroll? I mean, this program, I believe April 1st was kind of the sunset date. And so as of April 2023, people would start needing to re-enroll. They can start being kicked off Medicaid. Does everybody re-enroll at once? Is there an open enrollment window? Or what's the basis for when an individual has to re-enroll?
Yeah, this is an important point just for expectation setting. So it's happening on a rolling basis. And if you've been in Medicaid for a couple of years, you probably know this already, but people tend to re-enroll at the same time every year. And it tends to be the month in which you first enrolled in Medicaid. So let's say you first got on Medicaid, in August, that was the first time. Your re-enrollment has probably been in August since then, and it will probably be in August again. And again, you can check on Compass and, you'll get warnings from DHS when your date's coming up. But all of this should be pretty consistent. And the important thing is, again, it's not all happening at once. Re-enrollment is going to go for the entire rest of the year. So it's not like a one and done thing. People are going to be doing it for the rest of the year.
Well, so this is an important point, because I think we all know people who ask their neighbors, right? And we always get these phone calls. So I worked in the government, we get these phone calls of, well, my neighbor got their Social Security check on this date. I did not. Where's my check? This is not something where you can check with your neighbors to figure out when enrollment is then. It's going to be different it could be different for every person in a community or in a neighborhood.
Yeah, absolutely. It has much more to do with when you first enrolled. So again, if you remember re-enrolling the last time you did it in August, September, whatever month, that's probably the month you're going to see that stuff again. But if you can't remember, you can find out. Again, there's those resources I mentioned. Compass, you can call your county assistance office. You can also go there in person without an appointment if you want to. And there's a list online of county assistance offices that's linked in that story. And you can also call, again, the customer service center.
Very good. One of the questions, and you touched on this a little bit, about who qualifies, who doesn't qualify. There are financial thresholds that are set. You mentioned in your article for a single person, it's $19,391 a year. For a family of four, it's $39,900. Your article links to a chart that has other stats and numbers, but it's not just a financial threshold, right? It's not simply how much cash on hand do you have. They're going to be looking at different assets as well.
Yeah, they look at different assets. They're not going to look at your home, but there is a list of other things. So for instance, like if you have stock in the company, if you're getting Social Security payments, those are things that are going to count. So it's all, again, you can kind of look for more resources online. It's going to be a lot to get through now because it is complicated. But yes, there are other assets that you could have that the state will count as part of your income.
So this is, we're returning something normal. Again, if somebody has been on Medicaid prior to the pandemic, we can expect a process that is similar to that. This was largely for those who came on Medicaid since the pandemic, that this is going to feel like it's something new. And we're expecting longer wait times, I'm assuming, with the staffing issues and the sheer volume of individuals having to reapply. I imagine the message from the state is be patient, make sure your ducks are in order, but be patient as we try to process this.
Yeah, well, the state's message has really been, we are going to reach out to you proactively. You can expect these communications, know what to expect, make sure your information is up to date, and also take advantage of the online resources that are available to you. I think it's, the point is that we have these resources now. It's a lot easier to go on a website and make sure your address is updated than it is to sit on a call for a long time, and maybe there's going to be call backlogs. But I think, Sam, the more important thing, and the thing that I want to stress, is that when a system gets overloaded, mistakes can be made. And that's one of the reasons I started looking into this, because I, had started to hear about these staffing problems and wanted to know if they were going to have an impact. And the kind of takeaway that I've heard from advocates, from labor folks, people who represent unions who represent the workers in DHS, is that we're not going to start to see the effects of understaffing and this larger workload right away. The concern is that as re-enrollment gets going and, the work compounds, people start having to go through appeals. As we get into the summer, there could be more stress on the system. And so that is when it starts to be really good to know, again, what your rights are and what your options are. So let's say you go through re-enrollment, you think everything's fine, you definitely think you qualify, but you're told that you don't qualify anymore. It could be a mistake, and you always have the right to appeal if you are kicked off of Medicaid. And there are also a list of resources like, legal groups, other advocacy organizations that can help you as sort of an outside resource if you're running into these problems. So again, I think that's another important thing to stress is you can always appeal. You're going to get an appeal in the mail if you get a disenrollment letter, if DHS, reaches out and says you don't qualify anymore. And you can also ask for reconsideration, and you can also try to just re-enroll if you really think things have gone wrong. But that's the concern, is that, again, mistakes happen. It's a big system. It's a lot of people. And so I think just making sure people are prepared for those kinds of eventualities is also important.
Yeah, Katie, that's a great note to end this segment on. This notion that mistakes are likely to be made just because of the sheer volume of re-enrollment, and there's a process after that if somebody does get disenrolled. We're going to go to a break. I want to come back and talk about a little more about that appeals process and what other options individuals may have if they do lose their health insurance on Medicaid. So don't go away. We'll be right back.
Face the Issues is produced and recorded in the studios of Lighthouse TV. Positively different.
Welcome back to Face the Issues. My guest again is Katie Meyer from Spotlight, PA. She's been covering the Medicaid re-enrollment process. Katie, when we left off, we talked about the fact that the system is going to be overwhelmed. This is nothing that is DHS's fault or the state's fault. Just simply there are more people on Medicaid now because of the pandemics, the fact that they did not do the disenrollment during the pandemic. And that's going to be a lot of people applying to re-enroll with a short staff. And so one of the things that when we left off, you're talking about was, let's say you do get disenrolled, that's not necessarily the end of the road, that there is an appeals process. If somebody gets that disenrollment letter, how should they go about appealing it? What's the first or second thing they should be doing?
So, yes. So the first thing is if you are disenrolled, if DHS finds that you're not qualified for Medicaid, they should inform you in a letter. That letter will have an appeal form. What's going to happen then is you're going to have at least 30 days from the time the letter was mailed. So not when you received it, when it was mailed, to initiate an appeal. And if you didn't receive a letter, if it was in the wrong language or something, you might have more time. So that's number one. If there's like some issue and you don't get a letter, you can use like any piece of paper that just says MA appeal, Medicaid appeal, and includes your signature and a date. So if there's a paperwork issue, you feel like you're missing materials, you can send that in. If you get disenrolled, you can ask for an interpreter if you need one, or if it'll help. You can submit the appeal a couple different ways. You can go to your county assistance office. And again, there's lists of those online if you don't know where it is. You can mail the appeal, but you should probably use certified mail just so you have like proof of the date you sent it. And you can also ask to keep your Medicaid coverage while you wait for a hearing while you're going through the appeal process. That's important. And then you can always ask a legal aid group for assistance. So there's a lot of those around the state. I have a list of them linked in that article. And then, of course, there's other things you can do. I mentioned this. You can ask for reconsideration. So if you have a renewal issue, you don't get back in, or you have a problem with the system, ask for reconsideration. You have 90 days to ask the state to reopen your case in most cases. And you can do that by contacting the county assistance office. You can go to the statewide customer service center. And you can also just, again, apply again. If that's your last case resort, if you believe that you are still qualified for Medicaid, but you've been told that you're not, you got kicked off the program, you can initiate a new application. You can go to Compass to do that, the online portal from DHS. You can do a paper application. You can do it over the phone with the customer service center. So you always have those options. And I think it's good to be aware of all of them.
So number one, appeal, a few different ways to do that. Number two, ask for reconsideration, which would be following the appeal. If you get denied again, you ask them to reconsider that. During that process, you mentioned that they can request to keep their coverage while it's going through this appeals process. And then thirdly, if you still get denied, you can reapply for it. So kind of three different options. Katie, I'm assuming there are going to be individuals who no longer qualify and who are going to lose that coverage. They're going to lose the appeal because they don't meet the thresholds anymore. They no longer meet the qualifications. How do they go about getting health insurance if that's the case?
Yes, so you're absolutely right. There will be people who just no longer qualify. So, and the numbers that we've got, and DHS has a couple different buckets of people who they think are probably going to get kicked off the program. There's a couple 100,000 who probably don't qualify anymore. And then there's, a couple 100,000 more who haven't been sending in their renewals like during this 3-year period where they actually didn't have to. And those are people that DHS considers like at higher risk of like falling off the radar, not successfully completing an appeal. So they could also lose it, but they would still be eligible. So that's kind of like the look at who might lose coverage. If you indeed no longer qualify, your income is just too high now, then you will receive information from DHS, or you should receive information from DHS about Penny, which is the state's marketplace for insurance. It's like our version of the Affordable Care Act. And so that, again, that's a kind of a whole nother system. It's going to be a new experience. But it's going to be an option if you want to get insurance on the marketplace instead of through an employer or something. I should also note, and this is kind of a whole separate but large topic, kids. If you have children who were on Medicaid, but your income is now too high, your kids are going to have a couple options too. One of those is always going to be CHIP. So the Children's Health Insurance Program, it has higher floors for income than Medicaid does. So you can qualify for full CHIP coverage. It'll be free healthcare for your kids, even if you'd no longer qualify for Medicaid. So and I have, those income floors linked in that article. You can also qualify for partial CHIP coverage if you make a little bit more money. And you can also get with any income level, fully paid CHIP coverage. So you are going to be responsible for copays. It's going to be more expensive, but you can still get coverage through CHIP at any income level. And that's an important one. I think when we're talking about kids, there's going to be a lot of kids who are affected by this re-enrollment. And so if you are worried that your family no longer qualifies, check to see if CHIP is going to be an option. And again, that is something that DHS should automatically give you in terms of information you're going to receive.
Yeah, let's talk about CHIP for a moment. I mean, our CHIP program in Pennsylvania is nationally known. The Congress has often used Pennsylvania's CHIP program as their example for other states. That is separate from Medicaid. They're both state-run systems, but what you're saying is that they have different qualifying thresholds and they are different programs.
Yep, you can make a little bit more money to get your CHIP coverage fully paid for by the state. And federal funds go into it as well. But yeah, that's a key distinction. And I should also say, and this is just like another side note, and it's another reason, a sort of technical reason, why there's more work on county assistance offices, on the caseworkers that deal with a lot of this stuff. The process for re-enrolling in CHIP is changing this year. It's kind of just like, it's unrelated to the actual like larger Medicaid re-enrollment, but the state had an IT change planned for a long time. And practically what that means for a lot of people is, in the past, if you're a person who's on CHIP and is familiar with the system, you know that you would usually go through your insurer. So CHIP works with a bunch of insurers, private insurers, and that was usually like your point of contact for re-enrolling and making sure you still qualify in the program and managing your information. That's changing. Now DHS is going to manage the CHIP re-enrollment, so they're going to be doing the assessments for eligibility in CHIP, and that's some additional work for the county assistance offices and other caseworkers. It does make the program more central. And you're still going to go through, your insurer for a couple things like coverage questions, but re-enrollment is now going to go through the state. So that's a distinction. And if that's affecting you, you should have already gotten communications about that, because it's just a little bit of a logistical change.
Understood. So CHIP is for children. So you have Penny is an option for if you no longer qualify for Medicaid. CHIP is the option for children, at least having your kids covered. What about Medicare? Right? Medicare and Medicaid often get confused with each other. Medicare is a fully federal program. How would somebody potentially qualify for Medicare?
Under certain conditions, if you're older, if you have a disability, again, there's a lot of different, things that can change what you are eligible for. And if you're a person who uses the system, you know how complicated these things can be. I didn't do a ton of reporting on Medicare or get too much into the specifics of that program and who qualifies for it. But it is, again, one of those things where you should receive information from the state if you do qualify.
So Katie, to sum up your advice for our viewers, number one, first and foremost, you said make sure your information is up to date. Make sure that you're able to get the notifications. Two, make sure you do this re-enrollment. Make sure you submit everything, the paperwork that they send you. Make sure you've got all that re-enrollment up to date. And then in the event that you are disenrolled, there is an appeals process, there's a reconsideration process. You can reapply. And if you are correctly disenrolled based on the standards set by the state, then take a look at Penny, take a look at CHIP for your children, potentially Medicare if you're a senior citizen or receiving Social Security disability, but there are other options.
Yeah, I think you summed it up well. That's it.
Katie, I appreciate you breaking that down. This is going to affect a lot of people in the state. Deeply appreciate your work on this issue.
I appreciate you having me on.
Don't go away. We'll be right back. Welcome back to Face the Issues. My guest again is Katie Meyer. Katie, thank you so much for joining us. What our viewers don't know is that oftentimes I'm on the other side of this interview from you. I have had the privilege of being interviewed by Katie on a number of different occasions. She is one of the best journalists I've had the privilege of working with. And so, Katie, I just wanted to ask, your career, you've been in this for several years now. You were with radio, you're now with Spotlight PA. What got you into doing journalism?
Well, I wanted to do it. Luckily, when, I got out of college, I figured out a way to start covering state government, which was something I was really interested in. I'm from New York, but Pennsylvania is a fascinating state. And so that was something I gravitated toward. I wanted to be, a journalist who could, cover politics, cover policy, and the intersection of those things. And so I landed in Harrisburg in 2016 and covered the legislature and governor and politics generally. Ended up in Philadelphia at WHYY, also in public radio. I was in public radio for the full first part of my career, and now I'm a Spotlight PA, which does more investigative work, but still on state government. And it's been a good niche, and it's fascinating, coverage area.
Let me ask you this. Oftentimes in politics, people are focused on the national picture. Everyone wants to know what the White House is doing, what the Congress is doing. Why does state government matter? If somebody were to ask you that, what would you tell them about why they need to pay as much, if not more, attention to what their state and their localities do as they do to Congress?
Oh, I mean, these are the governments, the governmental entities that have enormous power and impact on people's day-to-day lives. So, the structuring of your property taxes, the laws about whether you can get an abortion, the laws about, how your school is being funded, what kind of, money comes into your public school, how permitting works, all these regulations that really shape the fabric of our lives, that comes from the state and the local level. And so getting into the factors that influence those decisions, I think, is really important. We could talk about a number of things that are very unique to Pennsylvania that shape the policy we get, anything from, the way that we fund public defense in this state, which is that we don't on the state level. We're the only state that does that, to the fact that, any number of things. State government is very important, and I could get into the many ways that it's interesting, but, our campaign finance laws, that kind of thing. But, it has an enormous effect on our lives.
Yeah. And it's funny, those issues you bring up, I think many people think they're federal issues, and yet to your point, the state probably has a bigger impact on them than the federal government does. And so, Katie, thank you so much for joining us. Appreciate the work that you do day in and day out, not just on this issue, but on all these other issues. And we'd love to have you back another day, another time, another issue.
All right. Thanks so much, Sam. Good to see you.
Good to see you too. That is our show for this evening. I want to thank Katie Meyer for joining us. And of course, I want to thank each of you for tuning in as well. We hope to see you right back here again next week. Until then, my name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.